Hey guys, this is Dr. Wijay from Elite Dermatology and the Oaks Plastic Surgery. You're probably watching this video because you're about to have your first free telemedicine visit with me in regards to your weight loss semaglutide program. If you're watching this video and don't have an appointment with me, your first call is free. All you have to do is text the number on this screen or visit us at theoaksplasticsurgery.com or elitedermatology.com. But the texting of our number will go straight to our schedulers to set up your first free weight loss consult with me via telemedicine. So how does semaglutide actually work? Semaglutide is the generic name of Ozempic and Wegovy. Semaglutide basically replicates natural appetite hormones. And what that does is it reduces the appetite feeling in your brain to make you eat less, therefore reduce your calories over time. It also slows down gastric motility, and by doing so you feel full, so you eat less. So the combination of feeling less hungry and full faster, we're seeing a tremendous amount of weight loss over the next 6 months and especially over the next year. I'm sure you have friends or a family member or have heard of it online of how well it works for weight loss. And it is true, on the majority of patients, it does an incredible job of working on your weight loss. So the next part is talking about semaglutide risk factors. The main and most common risk is nausea and constipation. If you're nauseous, our coordinators can prescribe you Zofran to help you with your nausea, and for constipation, just do over the counter. Some contraindications for the medication, and if you have any of these, please let me know. We do not prescribe this medication for anyone who's pregnant or breastfeeding. Semaglutide has a very rare form in a rat model or a rodent model of MEN type of thyroid cancer. So if you have any family history of thyroid or nodules, cancerous nodules on your thyroid, please let me know. We wouldn't prescribe it in that case. That is different from someone who has hypo or hyperthyroidism. We're specifically talking about cancer. Patients who are currently on diabetic medication. Semaglutide originally was a type of diabetic medication. So if you're on diabetic medication and you add semaglutide, your sugars can drop too low, making it unsafe at that time. So if you are on diabetic medication, let me know and we would have to come up with a plan to make sure your sugars are safe, and we will go through that on an individual basis. The other risk factors, if you have any family members or yourself who's been allergic to semaglutide, which would be hard to know, but technically if you're allergies to semaglutide, we would not prescribe that as well. Additionally, when you're on semaglutide, of course your calories are going to reduce, and patients always ask me, what diet and exercise regimen should I try? Well, it's very important to make sure to maintain protein consumption, because it is seen that there's a chance that you can have some muscle loss because you're not working out and you're not eating protein. So make sure to eat protein, and specifically weight train. Not cardio is great, but more like pushing and pulling of weights or push-ups to maintain muscle mass.